experimenting with this. We'll see what happens. But anyway, some people seem to like it. My wife seems to like it, which is more important.
Well, that's what counts the most.
Yeah, exactly. Okay, here we go. Dr. Tien, how easily can infections spread in nursing home facilities, and are vaccines effective at lowering transmission rates in these settings? I know that if you can answer that question quickly, and I've got some follow-ups here.
Absolutely. It's like a spark into dry hay. It goes really, really fast. You've got people who are vulnerable because of compromised immune responses, and then you've got family members coming in and out. So absolutely, it can spread very, very quickly.
Okay. Why has there been COVID vaccine hesitation among healthcare workers? It seems ironic, no?
Yeah, I think it has a
I
matter
know
to
you
do.
you mentioned this, but if you could elaborate a little bit, please.
Yeah, absolutely. I think you have to kind of figure out the healthcare worker and who that healthcare worker is getting information from. I think you'll find that surveys have recently said that physicians, pharmacists have actually been showing an increased acceptance and actually vaccination rate. I think we still have challenges with healthcare workers such as nursing aides who work predominantly in nursing homes because of education, and I think and also because of the fact that these healthcare workers are extremely high stressed, and they're also looking to continue to move on in their careers. There's a lot of turnover. And so I think as a result of that, I think we need to continue to emphasize the education and outreach to healthcare workers in nursing homes, nurses, nursing aides, because they don't always have access to the most important information. And sometimes the anti-vaccine messages may predominate in some of their social circles. So I think we need to be very, very aware of what they're hearing, what they're listening to, and providing education is indeed one of the most important ways we can move them along with regards to obviously accepting a COVID-19 vaccine and getting those rates up among the nursing aides and nurses.
Thank you very much. Do nursing home facilities with higher reported rates of vaccination residents staff have lower rates? In other words, if they're vaccinated, and I know that not everyone has access to a vaccine, are there lower rates of infection?
Yes, absolutely.
We
So
have
not
stats.
only just, yes, we do have data on that, not just in terms of what we've seen with COVID-19, where the effect of vaccination of both the patients and the staff has been tremendous in reducing mortality. We also have data with regards to the more traditional adult vaccines like influenza, and how vaccinating staff as well as the patients have reduced infections in those facilities as well.
Now, what about in other words, other diseases, as far as educating staff, what have you, with regard to other vaccines? I mean, one silver lining is that we've learned so much during the pandemic, but shouldn't we go further with other vaccines?
That's a great point, sir. I think absolutely. I think what COVID-19 vaccination education has shown us is that we've got a public that's hungry for information about vaccines. And the great news is that now when I speak to the public, I don't have to go into those details about why vaccines are important anymore. And so I think this is a rising tide that can lift all boats. We can make sure parents, patients, adults, younger adults, adults with chronic conditions, all understand the importance of vaccination and getting a vaccine. And I think this is so critical. This is what COVID-19 has shown us. And I think we need to build upon that and make sure that now when these adults and these other patients show up to get vaccinated, they don't get turned away because of a financial or logistical barrier. So thank you very much for that question.
Oh, my pleasure. And I would like to recommend, I've said this before to the committee, Madam Chair, I had a teletown hall meeting, and I plan to do some in-person meetings as well with my constituents. And we invited experts to come in and answer questions with regard to the vaccine. I think it's so very important to get the word out there. Thank you very much, Madam Chair, and I'll yield back the 45 seconds. Thank you.
Okay, thank the gentleman.